Okay, hi, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment first, and on initial review, things are checking out pretty good. The plateau, the tibial plateau down below, looks like the cartilage is nice and smooth and white. The meniscus, and as we're talking, I'm actually flushing a bunch of water through the knee. That's why the picture keeps changing. The meniscus here looks pretty good. And this is the anterior horn up towards the front here. Body of the meniscus back in this region, and the posterior horn, as we clear things out, is going to be way back here. And that looks pretty good. Articular cartilage on the femoral condyle also looks pretty good. So we're going to look in the central part of the knee next. Okay, so here's the central part of the knee. The anterior cruciate ligaments over here on the left. And as we irrigate the area, that looks pretty good here. And so now we're going to look in the lateral compartment in just a minute. Okay, so we're looking in the lateral compartment. Things are checking out pretty good. Actually, we do see the injury here. You can see there's a little injury to the articular cartilage right here, even a loose piece right there. Posterior horn looks pretty good. And I don't see any other significantly unstable cartilage, but we're just using our suction to make sure. And it looks like the meniscus here has had a bit of an injury there that you can see in the body here. See, there's a little bit of a split tear here. And here's, I think, the main issue is that this cartilage on the tibial plateau, you can see how it's a little bit frayed there and a little bit unstable. So I prefer not to remove it. This is what we use our orthobiologic injections a lot for. So that's the platelet-rich plasma or even the bone marrow concentrate injections that we do in the office to try and support, stabilize, and stimulate this cartilage to heal as much as possible. I don't want to leave anything clearly loose, but we can see where the damage is right here in the knee. Okay. In terms of the meniscus, the popliteal hiatus is right there. So there's a normal gap in the meniscal attachment right about here. And that looks relatively stable. I'm going to keep looking at this for a minute here. Okay, so here we're getting a look from the medial side. The camera's coming in medial now. And so here you can see the cartilage. Here's the posterior horn of the lateral meniscus. And then here's where this meniscus was injured, right through this area. Looks like he had a little bit of a split tear. Do you have a backbiter? Like something?
Did you say a backbiter?
Yeah, like a meniscal biter that cuts. No. Okay. So, question is this part of the meniscus unstable enough to need to be repaired? And at this point, I don't think it needs a repair, at least not a suture repair. But this is a difficult problem in somebody as young as you are because the cartilage is already showing signs of trauma. You got some loose pieces that have already flaked off a little bit. And you've got this meniscal injury kind of at the junction of the anterior horn and the body. So we're going to evaluate this a little bit more. I'm going to put the shaver and use it as a probe here. You can see that meniscus is pretty mobile there. So we've switched the camera back to the lateral side. You can see the cartilage erosion that you've got here on the tibial plateau. As we back up a little bit, just to give you an idea of the size, maybe 5 millimeter area. Here's the anterior portion of that meniscus that we've been evaluating here. And our main question right now is about the stability of that. And as we move your knee, we're just going to have a look at it. So that's flexion past 90. There's full extension. Let's go back to figure 4. Okay, so we're all done here. We're just going to show you as we clip the suture tail. Okay, and what we've done is what you see there. We've got a stitch in holding that meniscus down so that it's stable. Here's the posterior horn. You can see the cartilage damage there. And hopefully that will allow that corner of the meniscus to heal and be stable. We're going to take it easy for a little bit and give that every chance to heal. But I'm happy with the way things look right now. We can rotate up and look at the patellofemoral joint as well. We've already peeked at it, but I can just show you on the video that the patellofemoral joint actually looks pretty good. No signs of any significant cartilage injury here. So we're going to finish up and be getting you back to the recovery room shortly. Good luck to you now. Bye-bye.